Hello friends, welcome to my channel. Today's topic is going to be very interesting. This is very important topic for all surgeons, general surgeons, gynecological surgeons and even orthopedic surgeons. Knotting is very essential. It is said that art of knotting is probably as old as human fingers. Knotting is essential skill for all surgeons, be it the open surgery or laparoscopic surgery. Knotting is even more difficult in laparoscopic surgery. The process of knotting inside the abdominal cavity or any body cavity during laparoscopic surgery by a laparoscopic instrument is called intracorporeal knotting, while in general when we put a knot in open surgery outside the body is called extracorporeal knotting. Obviously intracorporeal knotting is a difficult job. Knots can be sliding knots or static knots, maybe simple or complex. Though there are recent advances in suturing technique, suture welding and knotless anchor technology like barbed sutures, still knot tying will always remain a necessary skill for every surgeon. The classification of knots and knotting technique is very extensive. Briefly telling about it, simple knots and knots for uniting ropes are the most frequently used knots. All knotting and knots in surgery are simple knots. The next frequent is eye knots, hitches and bends, ring knots, shortenings, ties and lashings, fancy knots, netting technique and splicing technique. You can see many different kinds of simple knots in the picture. This is derived from a very old book written in 1890s. So we can see the two common knots used in surgery, the figure number 4, the square knot, and figure number 6, that is the granny knot. As already told, the commonly used knots in surgery like open surgery are REEF knot, that is square knot, surgeon's knot. Square knot is considered better than granny knot because it is considered more secure. These all are fixed and static knots, and in laparoscopic surgery we frequently use Rodder's knot, Metzger's knot, Weston knot, West Point knots, and these are sliding knots. These are basically meant to tie some appendicular base during appendectomy, some vascular stumps, because intercorporeal knotting and making square knots, REEF knots is a tedious job and is done only by experts. You need a lot of practice for this. If you know the technique of creating these sliding knots, you can create them extracorporeally with the same suture material you like and put them inside the cavity through the ports and use it as a sliding knot, thereby saving the cost and time. Now talking something about sliding knots, the list of sliding knots is exhaustive. The most simplest one was a Duncan loop. Later it was modified in different forms to make it a Rodder's knot, Metzger's knot. Metzger's knot is a modified Rodder's knot. Later Dr. Misra from India only made a knot called Misra's knot, and there are a lot many like Nicky knot, Hangman's knot, Secure knot, Blur skip knot, Weston knot, and many more. This is a 2D diagram showing different kind of sliding knots and the method. I will demonstrate how to make these knots and the common ones during the video session. So as already spoken, intercorporeal knotting is a difficult job. You need a lot of expertise, training, skill and time to do intercorporeal knotting. So to facilitate, commercial loop sutures with sliding knots are available for tying the stumps or some tubular structures. You have clipping devices like Lia clips or Hemolock. So the disadvantage of these techniques or these advances is they are expensive. For example, if you take a simple catgut suture, it will cost around 200 to 300 rupees in India. But if you see the cost of the commercial catgut Indo loop, it costs around 1500 to 2000 rupees. The other recent advances as an alternative to intercorporeal knotting are sealing and coagulating devices like harmonic scalpel. You can use harmonic scalpel to seal and cut the tubular structures like vessels. You can use bipolar cautery or inseal. It is a for the structures with greater diameter. You can use Indo-GI stapler with different size cartridge. For vessels it's white, and for gut maybe blue or green or golden. Again, the disadvantage of these advances is the cost. These are highly costly devices, not affordable to all Indians, and you need skill and instruments to operate these techniques. This is a slide showing reef knot, that is square knot. See the morphology of square knot. Here two threads are connected in the upper second picture. Toward the left side, toward the right side, you can see the blue suture ends are coming from underneath the red loop. Both are coming from below it. Similarly, in the left side, you can see both are coming from above the loop. So this is the characteristic feature when you see the morphology of square knot. So this is a picture just to demonstrate how square knot is made. We'll have a live demonstration. So now coming on to granny knot. Granny knot is also very similar to square knot, but square knot is considered better, more secure than the granny knot. So please always learn and make square knots during surgical knot time. We'll see the difference between two, putting both knots together. Now see here, in the granny knot, the crossing are in opposite direction, and in square knot, the crossing is toward the same side. So what is surgeon's knot? Surgeon's knot is also a square knot. The only difference is during the first half hitch, you will give two throws, two hitches on the first step, so that the suture will not slip out and will remain tight as per your desire, so that you could put another knot above it. So we'll have a video contain live demonstration of square or reef knot, granny knot. We'll see the difference. We'll learn how to make surgeon's knot. We'll also learn how to make sliding knot for laparoscopic surgery. We'll demonstrate two common knots, Roder's knot and Metzger's knot. We'll demonstrate the technique of making square knot by different methods, by using middle finger and index finger, by using just index finger, or by using middle finger only, by thumb pushing technique and index finger pushing technique, and finally by the use of instruments.